Hello, my name is Duane Johnson. It's February 11th, 2018, and this is my anatomy and physiology overview of the axial and appendicular skeletal systems overview. Let's get started. So we're going to start with the axial skeleton. So we have the anterior skull, which is the nasal, the sphenoid, the lacrimal, the ethmoid, the zygomatic, the maxilla, mandible, frontal, and vomer, which I don't have because my dog ate, but it's the little center bone that's right here. Next, we're going to the posterior skull. So that's the back side. We have the mandible, the occipital, the parietal, and the temporal, which is on the sides right here, and also on the sides right here, right below the parietal. Next, we have the lateral skull. So here we have ethmoid back here with the frontal in a lateral view, the lacrimal, mandible, maxilla, the nasal, occipital, we have right back here, parietal, also temporal, and zygomatic. All this is lateral skull. And then we have the inferior skull. So we'll take a look inside. So inferior skull, we have ethmoid right here. We have the frontal right here, occipital back here, parietals right back here with the temporals right next to it. And then we have the sphenoid right through here, which is that little butterfly bat-shaped goggle kind of looking thing, mask I guess. And then we have the vertebral column that we're going to. Here we have the atlas at the very top, the axis right below, the cervical vertebrae. So 1 through 7. Then we have the thoracic vertebrae, which is after those 7, the 12 following. And then lumbar, the next 5 following. And then the sacrum is all this whole fused bones. The apex of the coccyx with the coccyx as well right here. And that's it for the vertebral column. And then we have the thoracic cage. We have the body of the sternum, manubrium, the true ribs 1 through 8, all connecting directly, or 1 through 1, 2, 3, 4. That's the clavicle. Underneath the first true rib is underneath the clavicle, and then the true ribs connect directly to the sternum, and the false ribs are all of the ribs underneath that do not connect directly to the sternum, with the 2 also consisting of the 2 floating ribs as well. We have the appendicular skeleton, the clavicle, which sits in front of the first true rib, and then the humerus, radius, ulna, as well as the scapula in the back. And then we go to the hand and wrist, and we have here, we have the right here, the capitate, let's see, capitate, hamate, lunate, the sesamoid, I believe, scaphoid, trapezium, trapezoid, pisiform, hamate. This one right here, I believe, is the scaphoid, the triquetral. Sorry. And then we have the metacarpals, the phalanges, and then we're going to the pelvic girdle. We have the ilium, ischium, the pubic bone, femur, patella, tibia, fibula. And then we have the ankle and the foot. We have the calcaneus, which is the heel. We have the cuboid, the talus. We have the medial cuneiform, I believe. Medial cuneiform, intermediate cuneiform, lateral cuneiform, and then also the navicular right here, and then the cuboid. I believe I said that. And that is it. Oh, also the metatarsals, I'm sorry, phalanges, and the talus. Right here.